Hello and thanks for joining us on Chicago Tonight. I'm Brandis Friedman. Paris Schutz has the evening off. Here's what we're looking at. Northwestern's new football stadium faces pushback. We have a preview ahead of tomorrow's hearing. COVID-19 cases are up. How you can stay safe.
When you're cruising along one of Chicagoland's highways, what's on your mind?
And WTTW News explains how our highway system gets its exit numbers. And now to some of today's top stories. Tragedy over the Labor Day holiday. Two 15-year-old boys were among 6 people killed by gunfire across Chicago over the long holiday weekend. Preliminary data from the Chicago Police Department shows 39 people were shot in 33 separate shooting incidents between Friday and Monday evenings. CPD data also shows an 8% drop in homicides and a 15% decline in the number of shooting victims this year compared to last. The city recorded 418 homicides and nearly 2,000 shooting victims in 2023 through the end of August. Both numbers are the lowest since 2019. One person is dead and another in critical condition after being pulled from Lake Michigan just hours after beaches were closed to swimmers. Meanwhile, another swimmer is missing. The Chicago Park District officially closed beaches for swimming at 7 yesterday evening. Around 10:30 last night, the police department's marine unit responded to a call and pulled a 27-year-old man from the lake in critical condition. The man subsequently died at the hospital. Just hours later, at 2:15 this morning, the marine unit recovered a 46-year-old woman who dove into the lake at Montrose Harbor and failed to resurface. She was transported to Illinois Masonic in critical condition. And the Chicago Fire Department reports that a swimmer who went missing off a boat this morning has so far not been recovered. Residents in Austin are lambasting the Federal Emergency Management Agency for what they say is an inadequate response to flooding that happened in July. Residents and their lawyers say FEMA and the Small Business Administration are lowballing people seeking compensation for flood damage. They also say that FEMA and the SBA have not done enough to make residents aware of federal assistance that might be available to them.
We shouldn't have to beg. We shouldn't have to beg for FEMA. We shouldn't have to beg for SBA. We shouldn't have to ask elected officials to do their job.
Many United Airlines passengers experienced a delay in their travel plans after planes were briefly grounded earlier today due to a technical glitch. A nationwide ground stop was declared after the Chicago-based carrier said they were experiencing a system-wide technology issue. A ground stop means that planes on the ground are held at their point of departure while flights in the air are allowed to continue to their destinations. The issue was resolved after about 40 minutes, but more than 200 flights were delayed. Up next, a preview of tomorrow's meeting on Northwestern's new and controversial football stadium. It's right after this.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
It's been a turbulent year for Northwestern football amid mounting lawsuits over a hazing scandal. A bright spot was a $480 million commitment to rebuild the 97-year-old football stadium by businessman Pat Ryan. But to fund the rest of the $800 million job without direct taxpayer subsidies, Northwestern says it needs revenue from at least 6 concerts. But many Evanston neighbors are pushing back on that proposal, and more than 250 faculty members have asked for a pause in the plan, saying, quote, "We need to get the existing house in order before expanding it." Here to talk about the issues and tomorrow's Evanston City Council Land Use Committee hearing are City Council member Devin Reed of Evanston's 8th Ward, Reverend Michael Neighbors, pastor of the Second Baptist Church of Evanston and the president of the Evanston North Shore NAACP, Periel Davis, the vice president of nonprofit community group Most Livable City Association, whose members are against the new stadium and concerts, and Evanston City Council member Eleanor Revelle, whose 7th Ward includes Northwestern's football stadium. Both Northwestern University and Evanston Mayor Daniel Biss declined our invitation to join this discussion. I thank the 4 of you for joining us. Councilmember Reed, let's start with you. You're in favor of the new $800 million stadium and concerts there. Tell me why.
Yeah, I think it's important for Evanston to be a cultural hub, and I think adding concerts and bringing in tens of thousands of people to Evanston will be good for Evanston businesses, will be good for promoting Evanston, and the build out alone will bring many jobs to Evanston, and Northwestern is committed to targeting those jobs to the minority community.
On the flip side, Councilmember Eleanor Revelle, you are against concerts at Northwestern's proposed stadium. Tell us why.
Yeah, it's very important to point out that there are two different applications that Northwestern is requesting. One is for the stadium facility itself, and the other is for the concerts. And yes, it is the concerts that I don't believe that changing the zoning code to allow those concerts would be consistent with the standards that the council is required to consider when we evaluate a zoning change.
Hasn't the university, though, suggested tweaking the number and audience size of those concerts as a compromise? Is that still not enough for you?
That it still means 6 commercial concerts, bringing 28,500 people to the 7th Ward, the middle of a very dense residential neighborhood. The parking plan is not realistic. It requires many concert goers to park in the downtown or on the lakefront, and then to take shuttles to the stadium, upward of 200 shuttle runs after the concert. I think that's not a realistic expectation.
Reverend Neighbors, what kind of jobs and funding has Northwestern promised Evanston's Black community if this stadium is built?
Well, there's been a great deal of commitment, not only after the stadium has been built, but during construction. Northwestern has made a commitment of offering at least 35% of all of those subcontractor jobs and small business jobs to Black and brown businesses, as well as women. That comes out to be about $208 million. They've also made a commitment for workforce development to the tune of about $10 million. And workforce development is an area that is centered specifically on young Black and brown adults. So those are some of the commitments. They've also committed 3,000 jobs will be made available during the construction, and we are making a commitment to Northwestern University as an NAACP to ensure that jobs will be permanent.
But those are said to be targets, not commitments. It sounds like you trust the university, though, to make good on those targets.
It's not that I trust them, it's that since they have made it public, as the NAACP president, we're going to make sure that they're holding true to what they've targeted.
Periel Davis, your group is opposed to both the stadium as well as the concerts that we've already talked about. Tell me why.
So I don't think that's completely correct. We're not opposed to the rebuilding. We are opposed to the concerts, but with regards to rebuilding, we actually think that there should be concrete promises made to the community. And actually, I take that back. We don't want promises because we don't think that those are sufficient. We do not believe in Northwestern's commitment to actually follow through, and we think that the only thing that can actually force them to do so is legal obligations. So we've been asking the City Council and other community members to force Northwestern to agree to a community benefits agreement that is legally binding, so that we don't have to rely on promises or whatever else the NAACP intends to do when they decide they just don't want to do things as they've done in the past. There have been other commitments that they have done for the community, including a work to have plumbers and to encourage people to get into plumbing and other trades, and they stopped that program after a year. And they have many repeated history of starting commitments and then stopping them as soon as it's no longer salient and once the issue is no longer in the press. And I also want to emphasize that while we're talking about jobs, it's completely ridiculous because when they, in their own stated documents, they do claim 3,000 jobs, but those are all construction-based jobs. Those are not guaranteed to go to residents, and they will only last for 2 years because construction is not perpetual. When we talk about permanent jobs, the jobs that they are talking about are almost entirely concession-based jobs for people who are working the stadium while they have these very few games and these very few concerts, which is not enough to maintain anyone for a stable living for a full-time job. These will be mostly part-time jobs. And also, if anyone is at all aware of the situation in Evanston, housing is expensive, it's ridiculous, and no one can possibly sustain a family in Evanston with these part-time jobs or these temporary jobs.
So you mentioned a community benefits agreement. Councilmember Reed, what would you want to see in a CBA?
I'd want to see a commitment to the city of Evanston. In fact, there was years ago there was a report compiled by city staff that estimated that if Northwestern did pay property taxes, they'd pay about $40 million a year. Now, this needs to be updated for inflation, but if you look at states or municipalities with strong agreements between their university partners and the municipality, Massachusetts is held up as a national model, and they would. So if we were in Massachusetts, Northwestern would pay 25% of their overall tax bill. That's $10 million, and so I'm looking for $10 million between the city of Evanston and our school districts, and I think that and we can get that through a surcharge on ticket sales.
Reverend Neighbors, you are not a fan of a community benefits agreement tied to the stadium. Why not? Would that not hold the university to account, as you said?
Well, it's a project that's going to be started and it's going to end. So if you're going to have a community agreement that's going to be signed, why is it going to be connected to the Ryan Field project? Why not say to the university, we want to have a community agreement bargain and we want it to be something that's going to last much longer than just the university? Why are we going to tie it around this particular project instead of going to the university and saying, you're going to have a community agreement and it ought to be in perpetuity? We're going to have something that's going to last for 100 years. It's going to be something that our grandchildren and our great-grandchildren will be able to take advantage of. But if you're going to have a community agreement that's tied to a particular project that's going to start and end, that just doesn't make sense to me. It's going to have to be much larger, it's going to have to be much broader, and the scope should be inclusive, going, again, as far as 100 years down the road.
So it doesn't sound like you just...
Go ahead.
It doesn't sound like you disagree with the community benefits agreement. It's just that you think that it should not be temporary. And if that's the case, then we can do that. That's like you can just say that. Like everyone agrees with that. The reason that we're tying it to the stadium is because you can't ask for something for nothing. And so if the...
It's okay, you can leave it out.
If Northwestern currently wants a stadium, we cannot get them to the bargaining table unless we have something to to offer in exchange. And so once we give up that leverage, once the stadium's over, we can't try to come up with a community benefits agreement afterwards. They've already gotten the milk. They're not going to try to fight any harder.
I want to get Councilmember Revelle back in here because despite issues with parking, noise, and traffic, you say that you are a reluctant vote yes on the stadium, but a no on the concerts, as we've discussed. Why the separation?
Well, I do appreciate the jobs that will come with the construction of the new facility, and it will be a much better stadium in terms of its ADA accessibility, its the fan experience, et cetera. So I do understand why it would be in Northwestern and its fan base best interest to have a new facility. I'd like to just go back to agree with Reverend Neighbors. I mean, I think Northwestern, as a stakeholder in the community, really needs to step up to a generous, ongoing commitment to the city. It's in the best interest of its faculty, its students, its administration, and I don't want to see it. I don't want to tie it to the stadium and the zoning change, because then it's like saying, well, if you offer us enough money then we'll change our zoning code. And so I in my mind, I keep them separate.
Beryl Davis, if Evanston City Council does vote for this stadium and for the concerts, will there be lawsuits?
Yes. I mean, we have a lot of support from, we have a lot of legitimate complaints with regards to zoning issues or I guess like structural integrity type issues with the stadium. In addition to that, we do have just general legal concepts that we're weighing out. Most prominently, though, I do want to say that one thing that we definitely will be pushing on, and we expect the City Council to do, especially if they're allowing concerts, is to recognize and require some degree of payment. Nonprofit organizations should not be engaging in business without paying property taxes the way that every other business and also every person resident in Evanston is paying indirectly or directly, which, might I add, is directly related to why housing prices are so expensive in Evanston.
We've got about 20 seconds left.
Yeah, and I just want to be clear that I believe the community benefits agreement should be focused on the stadium and on what the stadium will bring to Evanston, and the value of the stadium and not on, I think we have to have a separate conversation that has long been called for about payments in lieu of taxes, a pilot agreement, but I don't think that conversation is appropriate here, but I do think we should be working to get more resources from Northwestern.
All eyes on Evanston City Council this next week. In the meantime, my thanks to Councilmember Devon Reed, Reverend Michael Neighbors, Perry L. Davis, and Councilmember Eleanor Revelle for joining us. Thanks, everyone. Up next, what you should know about a spike in COVID cases. Stay with us.
Where have we been? Where are we at? Where are we going?
Essentially to be able to help anyone and everyone in the community, whether that's through academic support, social emotional learning, or just providing a safe space for youth to be able to be there.
This is the fabric of the neighborhood. You need to take care of the neighborhood. It's an ecosystem.
COVID-19 cases are creeping back up. The city is seeing a rise in lab-confirmed cases and emergency room visits. But a new vaccine is expected to be ready for the fall season. Joining us to break down the increase and the new vaccine is Dr. Susan Bleasdale, Chief Quality Officer and Medical Director of Infection Prevention and Control at UI Health. Dr. Bleasdale, welcome back.
Thanks for having me.
Feels like we haven't seen you in a little while because maybe some people have forgotten about the pandemic and COVID, but daily averages as of the end of August show emergency room visits increased about 7% over July and an increase of about 80 cases over that same month. How concerning are these increases?
Well, I think it's important to remember that COVID's not gone. It's here. We anticipated that we'd get some increases, especially in the fall as there's increased activities. We're ending the travel season over the summer. Schools are coming together. These are opportunities for transmission. We have new variants that are coming out, but we know what to do, right? We know that certain things will help. Don't go to work or school when you're sick. Make sure you get tested for COVID because cold-like symptoms could be the flu, which is going to be coming, or it could be COVID or other respiratory viruses. Make sure you get tested. Make sure that if you're vulnerable that you get vaccinated and you take advantage of the new vaccine that's going to become available. And masks work, especially for those that are very vulnerable.
I should correct myself. I said 7%, should be 0.7%, obviously, and that's very important. Are there any variants that we need to watch out for? Obviously, at the height of this, we were always keeping an eye on what the new variant was going to do.
So you point out the 0.7%. It is important that there are increases, but overall, the line for hospitalizations is still low. In Chicago, in Illinois, and most of the country, we are still at low levels of hospital admission, but it's going to be important that we take advantage of the vaccine. The current variant is increasing into this other Omicron variant, which is EG, is one of the subvariants. The vaccine that's supposed to come out later this month was directed against XBB, but it's been tested against this new EG variant and the other FL variants that are circulating now in Illinois and Chicago. So the vaccine that's going to become available later this month is something, especially those that are most vulnerable, take advantage of. But everyone should be considering getting boosted with this new vaccine that is going to be available for 6 months and older.
Now, we mentioned these stats just a bit ago. How much of an undercount do those represent? People aren't getting tested at public health offices the way we used to.
So there was a change in how we're monitoring the virus, and that the level that you can look on the CDC website, the level of transmission, or the Chicago Department of Public Health site, and it'll show green, but that's related to hospitalizations, which is not a marker for the testing that's happening in the community. So yes, the numbers that are going up and those that are coming into the emergency room may be an underrepresentation of the amount of COVID in the community, but what we're watching for is how many end up in the hospital, which is the most important, is how severe is COVID and are our hospitals becoming overwhelmed by COVID? And we're not at that point right now. We're still at low levels in most of the areas across the country, thankfully.
Public health officers are also using wastewater to count and to manage how much we're seeing.
This is another tool that we have to kind of see in anticipation. What we see is usually increases in the wastewater, increases in the community, then hospitalizations, and then deaths have been the last lagging indicator. Thankfully, because of vaccination, past immunity, we're not seeing deaths to the same degree that we had early on in 2020 or even with the first Omicron surge in 2021. So again, we know what to do. We know who is most vulnerable. And I think even with the Omicron surge that started in the kind of the winter of 20 into 21, people thought they were vaccinated and there was no way that they could get COVID-19. But we know you can still get it, so it's important that if you are traveling, if you have symptoms, you're not going to go see someone who's vulnerable within the week after you might be at risk for getting COVID. So we know how to do this. We just have to remember what works. And remember, COVID's still with us, but we can live with this in the right way.
Based on what we're seeing, are we expecting, is this increase going to pretty much continue?
This increase is going to continue. Right now, again, we're in the fall, we're gathering, we're going to see these numbers go up. But the important part is that we keep the number of hospitalizations low. And that's through vaccination, that's through protecting those that are most vulnerable, and that's through making sure that if you have symptoms, you get tested and you don't go around others so that you don't transmit.
Let's talk a little bit more about the vaccine, the newer vaccine that's coming out and how it's going to be different from previous vaccines.
So this vaccine is directed against what has been circulated. It was decided in June that this would be the type of vaccine. So the vaccine is now manufactured by several. We're going to have one available from Pfizer, one available from Moderna, and one that's also Novavax. So those are the ones that are targeted against the more recent variant, so it's going to help give better protection than what we had in the past. Sort of like what we have with the flu, and that's important. The flu vaccine is available right now. We anticipate what's going to happen in the fall. The flu vaccine is designed, and then we administer it to help protect through the season. This was designed in June. We still have the variants that are it's directed against, and it's been tested against the new variants that are coming in, and so it's going to be important for us to take advantage, like the flu vaccine.
And before we let you go, people without insurance, how can they get this new vaccine?
Yes, that's important because now this is not provided by the federal government, but most insurers will cover this, and the federal government has provided programs for those that are uninsured to be able to get it, and the Chicago Department of Public Health is partnered across the city in helping to provide vaccine for those that are uninsured.
Okay, so people should be checking out their public health office for that.
Yes, and their local hospitals that are getting support through these programs through the Chicago Department of Public Health, such as our hospital.
Dr. Susan Bleasdale, thank you so much for joining us.
Thank you for having me.
Up next, the highway exit system in the latest installment of our WTTW News Explains series. But first, a look at the weather. Our WTTW News Explained series has already given you the lowdown on Chicago's grid system, how it got started, and how it can help you get around town. But what about when you're on one of our local expressways? Sure, they aren't always that express, but they do contain some useful information you might not be aware of when you're on the road. Here's Nick Blumberg to explain how our interstate exits are numbered.
When you're cruising along one of Chicagoland's highways, what's on your mind? What song to play next? Where the nearest burger place is? When all this construction will be finished? Do you ever find yourself wondering how all the exits got their numbers? It's relatively simple, but not necessarily intuitive. For interstates in Illinois that run north-south, like I-55, the numbering system starts at the southernmost point the highway enters Illinois. For interstates running east-west, like I-80, the numbers start at the westernmost point. A lot of times, the very first turnoff is exit 1, but the next one isn't necessarily going to be exit 2. That's because the numbers correspond not to how many exits there are, but to how many miles away from the border they are. So by following the exit sign numbers, you can actually track how far you are from the state's boundary line. Sometimes things get a little tricky. Where two interstates merge, the numbering system for one supersedes the other. For example, if you're heading downtown along I-90 where it meets I-94, the exit numbers jump from 84 down to 44. Which brings us to one more wrinkle in the system. Around the city, I-90, that's the Skyway, Dan Ryan, Kennedy, and Jane Addams, and I-94, or the Kingery, Bishop Ford, Dan Ryan, Kennedy, Edens, and the Tri-State Tollway, mostly run north and south. But the signs all say east and west. What gives? Well, don't forget about the inter part of interstates. Our highways are part of a nationwide system, and 90 and 94 broadly run east-west across the country. They've just got to curve around pesky old Lake Michigan to carry on their merry way, so they move north-south through the Windy City. So the next time you find yourself stuck in bumper-to-bumper traffic, you may not know how long you'll be sitting there, but at least you'll know how far your bumper is from the border.
And now you get it. You can see more from our WTTW News Explained series on our website. That's at WTTW.com/explains. And that's our show for this Tuesday night. Join us tomorrow night at 5:30 and 10. Addressing the fiscal cliff facing the Chicago area's public transit systems. And residents will get to grill incoming Chicago Police Chief Larry Snelling this week. Our Spotlight Politics has a preview. Now, for all of us here at Chicago Tonight, I'm Brandis Friedman. Thank you for watching. Stay healthy and safe, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm that is proud to be a multilingual law firm that provides translators for a variety of languages.